Hello again, everyone. My name is Marty Guthmiller, and I am the CEO at Orange City Area Health System. Bringing to you today the 41st edition of our COVID-19 community briefing. As it is a Monday, I will start off today by bringing you up to speed with our local scoreboard. At this point, we've had 67 positives here at Orange City Area Health System of 1,040 tests. That is currently a 6.4% positive rate. That rate is going up a little bit. The last time we spoke, it was 6.0. So it is still less than the state percentage, but is a little bit of an increase for us. In the last week, for those of you without you having to check, that's been, last week we were at 57. And so this week we are at 67, so plus 10, and that's plus 10 cases out of 96 additional tests. So that's where we are there. In Sioux County, 561 positives of the 3,740 tested. That rate is going down as a percent positive at 15.0%. Yesterday, as an example, that rate was 9.3%. So we are trending down. If you consider this time 5, you go back to 4, 3, 2, 1 of our reports here, we're at 15.9, 15.6, 15.5, 15.2, and now 15.0. So clearly trending down in the county. It's not rapidly trending down. Region 3, 20 Northwest Iowa counties, 27 hospitalized currently as of this morning. That number when we spoke last Friday was 34, so we've had a nice decline there. There have been 5 admits in the last 24 hours, and there are 7 people in the ICU. That number was 12 when we spoke last time. So some significant improvement in Region 3 as measured by going from 34 to 27. In Iowa, as a state, we're at 42,845 positives of the 455,740 tested. That positive rate is 9.3%, which is remaining steady. It's been several times now we've reported 9.3. The multiple times before that we've spoke, it's been 9.4. So not going anywhere rapidly, but trending slightly lower, but just call it steady at this point. Another metric that we measure, again, that I particularly use in terms of what is the acuity of these positive patients is the rate of hospitalization. And we've been mentioning that the hospitalizations have been going up in the state of Iowa rather consistently and pretty significantly. That trend is not continuing today in the form of that it has gone down, but only slightly, down from 213 to 209. So 209 patients are currently hospitalized in Iowa as of this morning with COVID-19 diagnosis. As has been the case and been our practice, we're going to regionalize that number a little bit. Sioux County, as I mentioned Friday in my little thing about statistics and you making them sound sensationalized or whatever that you can do. I'm going to tell you today that the hospitalizations in Sioux County have decreased by 50% since the last time actually by 33%, decreased from where we talked on Friday. But again, that's from 3 to 2. So we dropped 1. So 1 out of 3 is 33%. So we've had a 33% decline, but again, don't worry about the percentage, think about the number from 3 to 2. O'Brien County is 1, Lyon County is 1, Plymouth County is 0, Dickinson County is 1, Clay County is 0, BV County remains at 0. Osceola County, 0. Woodbury County remains at 10, no change. Polk County is at 41. And that number was 51 when we spoke on Friday. But again, when you go back and you look at the Northwest Iowa counties I mentioned, zeros and ones predominantly, Woodbury County with 10 and Sioux County with 2. So not exactly earth-shattering numbers there. The deaths reported are plus 36 from a week ago. We are at 829 deaths in the state of Iowa. And so clearly, again, this marathon continues, and we are not yet in the final stretches of this marathon, it would appear. So those are our stats. Generally speaking today, probably a little bit better on a statewide basis. That changes daily. So obviously we'll keep tabs on that and keep reporting the numbers. Again, if you want to go research some of this stuff on your own, it's coronavirus.iowa.gov is where we get all this information. I'm going to shift gears just a little bit and talk about a couple other things, maybe more relative to what we're talking about than simply regurgitating some stats. The first unfortunate thing I need to report today is that we've had our first positive nursing home resident at Prairie Ridge. And that what that requires at this point is for us to return to phase 1 from phase 3 that we were in. Well, what does that mean? Well, it largely means that people will be eating in their own rooms. Residents will be eating in their own rooms, except in cases where people need feeding assistance. But we have to move back per state requirements to phase 1. Family visitation will continue outside in the normal process that we have identified, but we'll need to be moving away. We have moved away from already the inside visits that we had lined up. And we've moved away from the communal dining, as I mentioned. These are all in following state criteria that have been published. We have to wait at least 14 days before we can evaluate moving again to phase 2 and then ultimately to phase 3. Typically there's 14-day waiting period in between each one of those. And so wanted to let you know that that's happened. We've been very fortunate so far that that has stayed away from us. There actually are 2 nursing homes in Northwest Iowa that I'm aware of that actually have outbreaks. Good Sam and George and Good Sam in Lamar's actually had outbreaks. And by the way, the definition of an outbreak is when 3 or more residents have tested positive within a defined period. So we've had our first. That patient is isolated, and all the family members at Prairie Ridge have been communicated with as is required. We have communicated with the Iowa Department of Public Health. I participated in a phone call with IDPH and our staff to go through the protocols. Again, one of the fortunate things that we have at Prairie Ridge is that it's connected to a health system. And when it's connected to a health system, you're often connected to infection control folks, different supply chains for PPE and testing and that kind of thing. And so we certainly got the impression that IDPH knew that we were on board with things and had things going as good as we can. And so just want to make sure that that's been communicated to all of you. We are also hearing out of the federal government that staff testing will soon be required weekly in the nursing home environment, and that rapid tests will be sent to us. But we've had no implementation date yet by the CDC for that, so that's coming apparently. When it does, we'll certainly employ that, and I think that's it from the senior care front. I'd like to move a little bit to the masking position. I mean, unfortunately, masking is getting politicized almost to the point that if you don't mask, you're a Republican, and if you do mask, you're a Democrat. Well, obviously, that's not very sound logic, and doesn't make a lot of sense. What I've been advocating all along is a common sense approach to masking. When in doubt at all, wear the mask. There's no question that masking helps. There's just the science is behind it. There's no question. What is in question is when you mask, when a mask is required, when a mask should be worn. And oftentimes we refer to that as the 6 foot, 15-minute rule. On occasion, when I choose not to mask, it's because I know that I will be outside of the 6 feet or less than the 15 minutes. The problem is that not everybody knows that I know that, and not everybody practices the same standard, either because they don't know or they don't care, one or the two. And so my philosophy regarding masking is becoming a bit more liberalized in terms of when in doubt, wear it. Again, my philosophy of using it is going to largely be governed by the 6 foot, 15 minute rule. I'm not going to wear it when I'm alone on a trail out in the country. I'm not going to wear it when I'm on the farm, but I am going to wear it when I go to the grocery store. And, you know, if everybody practiced the social distancing rules, the masking question would not be an issue. But the problem is, again, either because you don't know or you choose not to, those distance and time requirements are being violated. And so that's where I stand on the issue. That's where that's where I'll be implementing personally at this point. Of course, in the health system, any patient provider contact is between masked people. Ideally, a mask to mask encounter or conversation is always best. We'll be dealing with that, and that's where we are. So please consider that yourself, and limit the opportunities that you have to be exposed. But we need to stop short of locking things down again. But I think a little bit of proactivity in our case, to be aware of these distances and timelines and practice that would be well served by all of us. Third, I want to briefly mention, I just received some questions once in a while, and I thought I would address those today also. One of the questions that I received is, how is Orange City and Sioux Center working with Northwestern and Dordt in terms of the coming back and opening up the colleges? The answer to that is that we are in conversations. Sioux Center Health, Orange City Area Health System, Northwestern and Dordt are in conversations with the governor's office to actually provide testing, a rather extensive testing to all athletes and students at the colleges as well as staff, and possibly even roll that into an educational pilot project throughout the entire county. We are working closely with the governor's office in that. Thought we were making some progress. Now we're backed up a little bit, but again, that's our plan. And the way I can answer that right now is that we are in discussion with Dordt, Northwestern, and Sioux Center Health in coming up with a plan. So that is out there, and we're working hard to do that. Another question was, when I mentioned that the number of people tested in Sioux County is 1 out of 9, as an example, which it is now. Does that take into account people who might have been tested 2 or 3 times? No, it does not. I do not have access to the statistics that indicate multiple tests. So in theory, if everybody only got tested once, it would be 1 out of 9. but we know that that's not the case, so it's probably something more than that. But simply don't have accessibility to the data for the multiple testing. The last question is, how are local hospitals and community health working together with the local school districts in reopening? Again, a little more complicated here because we don't want too many cooks in the kitchen. You want really the public health to be directing the educational assistance in the county for reopening. We'd like a singular voice in that. And so you don't want too many people giving too many opinions. To that end, all of the infection control nurses from all 4 hospitals in Sioux County have been meeting or had met with community health partners, our public health arm in Sioux County, and work with them and school districts in trying to come up with a singular policy. That's a work in process yet. But the health systems are kind of, I would say, almost behind the scenes a little bit, working as a resource with public health in kind of helping public health form with the districts a definitive plan for opening. We firmly believe that the schools should open, yet we understand that this is a complex environment that has balances that we have to do in terms of pros and cons, but that's where we are. So those are just a few questions that I've received, and I want to be able to respond to those. And again, we'll do that if folks have other questions. Clearly, I've referred to this journey as a marathon. It truly is. And today, I feel like I'm at about mile 24. The burden is a little more real today. The burden is a little bit more palpable, just because it's the length of time here is wearing on all of us. I'm certainly not immune to that. I'm sure all of you out there are not immune to that. But it's really, really important to stay strong through this thing, stay vigilant. I do believe we're on the home stretch. It's still, we still have a fair amount of the race to complete. But again, one of those things that we've said from the very beginning is we know we won't get everything right. The one thing we can assure ourselves in is that we won't do everything right. And so the introduction of grace and the introduction of cut people a little bit of some slack out there is a good one. We all need it. We truly do. So again, as we close today, I just remind you and encourage you to stay vigilant, stay strong, and stay healthy. Thank you again for joining us.